Dr. Cooper, as the ALS Ice Bucket Challenge has turned into a worldwide phenomenon, many people are now focused on ALS and building awareness around this terrible disease. Tell us a little bit about the disease and some of the symptoms that people may experience.
Okay. Well, what's frightening about ALS is it typically affects people in the prime of their life. That's Lou Gehrig, who was the baseball player, or young adult males, even though it can affect females. I've seen it in 18-year-olds and I've seen it in 80-year-olds. It's very insidious. It's usually months before a diagnosis is made. It'll present with weakness of an arm or a leg, and that will gradually progress, and they'll start losing muscle and they'll get twitching of their muscles. And if you're not sure about it, you just wait a couple months and then it becomes very obvious. A lot of things overlap with this, so a lot of people think they have it when they don't. Unfortunately, it's relentlessly progressive, and the average lifespan can be 3 to 5 years. But that itself is confusing. Stephen Hawking, the famous physicist, was told 40 years ago he had 6 months to live, but he's had aggressive care over the years, which is purely supportive. There's no medicine for the disease. There's a couple of experimental medicines that have helped a little, but really nothing really treats it other than providing physical things like wheelchairs and braces and help with feeding and breathing. All this can be done. And if it's done preemptively and aggressively, you can expand somebody's life, but we can't make the disease stop, which is why there's research going on and why everyone's so concerned. As I mentioned, it's young, healthy people, and that's frightening to everybody.
Now, Dr. Cooper, you shared with me that during your career, you have treated dozens of patients that had been diagnosed with ALS. Are there warning signs or symptoms that patients might experience before being diagnosed?
As I mentioned, the combination of weakness, shrinkage of muscles, twitching of muscles, and progression to other muscles. It usually just starts in one arm or one leg. Occasionally it can start with problems swallowing, and it doesn't affect the arms and legs. But it's very subtle, and people rarely realize it's even happening at the beginning. It's just that after a while they notice they can't do things they could. They're tripping over their foot, or they're having trouble swallowing food.
And finally, Dr. Cooper, what are your thoughts on the ALS Ice Bucket Challenge? This is something that has built a lot of awareness with millions of people donating money and spreading the word across social media. Just kind of from a neurologist standpoint, what are your thoughts on that?
Well, I think it's great because, the more we pour into research, the more likely we are to come up with something. There's different approaches. There are genetic approaches, there are metabolic approaches, and eventually, because it's a very specific abnormality pathologically, I think they're going to find something. And any way people can get money, even if it's silly, is great. So I'm all for it.